I'm just going to spend just a minute or two talking about, and maybe a reminder, a bit of a broken record about public health measures in general for COVID-19. When I look at the modeling that was provided by the Ontario Science Advisory Table last week, which shows the potential for the resurgence of COVID-19 or a fourth wave of COVID-19 to have quite a high number of cases, even with a high vaccination coverage rate, it really, I think, speaks to the need for people to remember the basic public health precautions. So wearing a mask indoors, wearing masks outdoors if you're not able to distance from individuals that you don't know or are not in your immediate household. Continuing to be aware of distancing and the number of contacts that you do have. We have noted that with easing of restrictions and more availability of social gatherings, as we identify cases, those cases do have a higher number of contacts. So a couple of months ago, when they might have had 1 or 2 contacts, now we're seeing 10, 15 contacts. A high number of contacts means a high potential for COVID-19 to spread. And so one of the measures that the Ontario Science Advisory Table included in their modeling was looking at the impact if people limit or decrease the number of contacts that they do have. So while we hopefully will not see the need for broader public health restrictions to be enforced under legislation again, I think we all individually can play a role by assessing what we're doing in our day-to-day activities and reflecting on the number of gatherings or places we've been to and the number of contacts we have had, and look at how we might be able to decrease this as we start to see higher numbers of COVID-19 in the fall.